There's another technique that we teach called the PRP technique, and the PRP technique is the initials stand for pain release phenomenon technique. And again, by sheer chance, we had a guy come in who had a painful elbow. It was restricted, but he had pain with a stretch in supination, I think it was, and an active contraction in pronation or flexion was painful. And it didn't fit a pattern of a muscle. A la celiacs, if you have a painful biceps, you might get pain with flexion of the bicep and stretch of the biceps. And so it's quite neat, and you come up with an assumption that it's the biceps. But this guy had bizarre signs, and I remember he was sitting there and I was holding his forearm in the painful range. Instead of letting it go when it hurt him, I just sort of held it there while I was talking. And after perhaps 20 seconds, 15 seconds, he said, "That pain's gone off." And I said, "Oh, of course." So I let it go, and he said, "Oh, no, it's still a bit painful." So I thought, "Oh, so I'll do it again." So I repeated the sustained, I think it was supination there, it just sustained it. And after a while, it went off again. He said, "It's going." And I found that as I repeated it, instead of taking 20 seconds, it took 15, 10, 8, 5, 3, and suddenly I could not reproduce his pain, stretching it in the way that had bothered him for 18 months. He'd had this history for 18 months. And he said, "I can't believe that." And I said, "Now, what was the other thing that hurt?" And it was gripping and flexing his wrist. It was a queer sort of movement. So, yes, you could feel that. So I said, "See what happens if we sustain it." And we sustained it. And would you believe, in 20 seconds, pain had gone. He said, "It's going." So I did it again, and after several repetitions, he was now pain-free. Now, when something alters like that, and you've had it for 18 months, it's chance occurrence. But you've done something, you better find out what it was. And of course, Maitland had produced a paper, or written a paper some years before, where he used compression of joints with movement to see if it produced pain and sustained them. So there were, say, 3 ways now of getting pain. One was to say stretch structures, another one was to use contractile tissue, and another one was to use some sort of compression. So I started playing around with chronic pain, not acute pain, but pain that had been there for longer than 6 weeks, been there for some months, to see if in fact it would alter when the pain was provoked at an acceptable level. And because of this, we had to have some guidelines. If you provoke the pain at a very, very strong level, you would make the whole condition worse. And so you had to find out what was acceptable. And an article is soon to be published, it's been submitted, explaining neurophysiologically how pain release phenomenon techniques can work scientifically. So I'm looking forward to that being produced. But it all came along by chance, and once you develop something, you've then got to have guidelines for safety. You just can't say, well, this is what you do with mobilisations with movement or PRPs, because you could do something quite stupid. And so as long as you've got safe guidelines, then you can get on with it and treat patients. And I guess one of the most exciting things with mobilisations with movement is that they're indicated when they produce no pain at all, so no patient's going to complain with that indication. They bring about an instant change. You don't have to wait a week or a day. It happens now, and that change should be long-lasting, or most of what you've achieved should last. Now, it's quite an easy concept when you're talking about mobilisations with movement. And pain release phenomenon techniques, they are painful, but the pain is tolerable and goes at the time of application. You don't have to have half a dozen treatments. So again, there's something nice about that. You can say to somebody, look, I'm just going to provoke this pain a little and see if it goes off. And if when provoking it gently it doesn't go off, then you don't use the technique. But you wouldn't provoke it strongly to see if it goes off, because then it won't either, because with a scientific article it'll show you why you can make them worse by over-provoking the pain. But it can be successful by just giving a tolerable level of discomfort. So really, it's exciting work.